All right, everyone, welcome. Today, we're going to tackle a topic that's, well, it's a huge deal. It's generating a ton of excitement, but also some really serious debate in the medical world. We're talking about large language models, or LLMs, and their role in healthcare. You hear that word revolution thrown around all the time, right? But what does that actually mean when people's health is on the line? As the next generation of clinicians, of researchers, it is your job to look past the headlines, to cut through the hype, and really dig into the evidence. And that is exactly what we are going to do today. So that's our mission here. We're going to take a real academic paper and use it as our case study. The goal isn't just to learn about AI, it's to learn the skill of how to critically read and analyze scientific papers, especially in a field that is moving at just warp speed. So here's our game plan. We'll start with the big picture. Is AI in medicine all hype? Then we're going to dissect the kind of paper we're looking at. From there, we'll dive into the amazing promise of LLMs, but also the very real dangers. And we'll wrap it all up with a critical toolkit you can take with you. Okay, let's get into it. The paper that's going to be our guide today is a Viewpoint article from Zhang and his colleagues. It's got a big title, Revolutionizing Healthcare, the Transformative Impact of Large Language Models in Medicine. Okay, first things first, let's get on the same page. What even is a large language model? You've probably played around with things like ChatGPT. Well, at their core, these are incredibly complex AI models that have been trained on just an unimaginable amount of text from the internet. They're essentially superpowered prediction machines, guessing the next word in a sentence, which is what gives them this uncanny ability to chat, to write, and to understand language like a human. And I mean, just look at this timeline from the paper. It's wild, isn't it? In 2018, we had these foundational models like BERT. And just a handful of years later, there's been this absolute explosion of bigger, smarter, and more capable systems. This incredible speed is exactly why we need to be having this conversation right now. Now, this next part, frankly, this is probably the single most important lesson of our entire session. Before you can ever evaluate the arguments in a paper, you have to understand what kind of paper you're even reading. You got to know what you're working with. So the Zhang paper is what's called a viewpoint, or a review article. Its job is to survey the landscape, to summarize what other people have already researched, and to offer an expert opinion on where things are headed. This is great for getting a big picture overview, but, and this is a huge but, it is not presenting new experimental data. This is not a clinical trial. And that means we have to immediately recognize its built-in limitations. Because it's a viewpoint, its conclusions are, by nature, speculative. They're educated guesses about the future. And you have to remember, there's always a potential for selection bias. The authors are choosing which studies to highlight. Now, this doesn't make the paper bad, not at all. It just means we need to read it with the right critical lens and understand the limits of what it can claim. Okay, so with that critical foundation in place, let's dive into the exciting stuff. What is it about LLMs that has so many brilliant people in medicine and science so fired up? What could this future actually look like? I think this diagram from the paper really says it all. The potential here is system-wide. I mean, think about it. At a community level, you could use these models to sort through public health data to predict the next flu outbreak. In a hospital, they could be optimizing everything from scheduling nurses to tracking infections. And for you, the patient, it could help make sense of your lab results. It's a vision for a healthcare system that's smarter and more connected at every level. And it gets even cooler, because the potential here goes way beyond just text. The paper talks about the next wave, multimodal LLMs. That's just a fancy way of saying the AI can see and listen, not just read. So imagine an AI that can analyze the doctor's typed notes, look at the image from an MRI, and listen to a recording of a patient's heartbeat, and then synthesize all of that data to spot a subtle heart condition that a human might have missed. This promise even extends all the way back to the lab. For basic science, LLMs could help discover new drugs by predicting how molecules will interact. And for clinical research, they could help design better, faster trials by finding the right patients, which is a huge bottleneck right now. The idea of speeding up that entire research pipeline, it's just immense. Okay, we've seen the promise, it's exciting, but any good scientist has to be a healthy skeptic. So now, we have to flip the coin over and look at the other side, the massive, massive challenges that the paper correctly points out we just cannot afford to ignore. The paper is really good about not shying away from these hurdles. First off, data privacy. We're talking about the most sensitive information a person has. Then there's the black box problem. If an AI tells a doctor to prescribe a certain drug, that doctor needs to know why. We can't just trust it blindly. There's also bias. If we train these models on biased data, they can actually make health disparities worse. Then you have hallucinations, which is a nice way of saying the AI confidently just makes stuff up. And finally, these things are incredibly expensive to build and run, which could create a whole new kind of healthcare inequality. And the authors really put a fine point on the stakes here. In medicine, a mistake isn't just an oopsie. Like they say right here in the paper, a wrong diagnosis or a bad recommendation from an AI could literally cost someone their life. That's the weight we have to carry with these tools. And to prove this isn't just some abstract fear, the paper cites a real-world example of Google's BARD model showing clear racial bias when reasoning through a patient case. This is a powerful, frankly scary reminder that technical bias isn't just theory. It's a proven risk that can cause real harm to real patients if we aren't incredibly careful. So, we've looked at the good, we've looked at the bad. Now let's bring it all home and forge that toolkit I promised you. How do you take these lessons and apply them to every single paper you read from now on? Here it is, 3 key lessons that will serve you for your entire career. 1. Always identify the type of research first. Is it an opinion, an experiment? That tells you how much weight to give its claims. 2. Scrutinize the evidence. Don't just read the conclusion. Ask yourself, does the data really say that? And 3, my personal favorite, always read the limitations section. It's often the most honest and most insightful part of the whole paper. Ultimately, the paper lands in a very wise and responsible place. The goal here is not to build a robot doctor. The goal is to build an incredible tool to enhance the expertise of human doctors. But we can only do that if safety, fairness, and just hardcore scientific rigor lead every single step of the way. And that brings us to one last big question. A question that goes beyond the science and into ethics and law. A question that your generation is really going to have to answer. As these AI systems get more and more powerful, who's responsible when it gets something wrong? Is it the company that built it? The hospital that bought it? The doctor who trusted its advice? There are no easy answers here, but it is the most important question we need to be asking.